Part C. In this part of the test, you'll hear two different extracts. In each extract, you'll hear health professionals talking about aspects of their work. For questions 31 to 42, choose the answer, A, B or C, which fits best according to what you hear. Complete your answers as you listen. Now look at Extract 2. Extract 2, questions 37 to 42. You hear a presentation by Dr. Aisha Malik, clinical pharmacist, on antibiotic resistance. You now have 90 seconds to read the questions.
My name's Dr. Aisha Malik, and my presentation is about antibiotic resistance, an urgent and growing threat to global health that pharmacists are uniquely positioned to address. And that probably explains why, among our patients, there's still a widespread misunderstanding about how antibiotics work, when they're appropriate, and why overuse can be dangerous. To my mind, this confusion stems from both misinformation and the historical overprescription of antibiotics for conditions they were never meant to treat. As pharmacists, we need to explain what antibiotic resistance really is in simple terms, and why it matters, starting with the basics of antimicrobial action. Antibiotics are designed to kill or inhibit the growth of bacteria, not viruses. Yet many patients still expect antibiotics for viral infections like the common cold or flu. When antibiotics are used unnecessarily or incorrectly, such as not completing a prescribed course or using leftover medication, it gives bacteria the opportunity to adapt and become resistant. These resistant bacteria survive, multiply, and spread, making future infections harder to treat. This is what we call antibiotic resistance, and it's already leading to longer hospital stays, higher medical costs, and increased mortality. We often explain to patients that resistance doesn't mean their body becomes resistant to antibiotics, it's the bacteria that evolve. Using analogies like training the enemy helps patients understand that every unnecessary dose of antibiotics gives bacteria a chance to learn how to fight back. We also emphasize that not all infections need antibiotics, and that sometimes the best treatment is rest, fluids, and symptom relief. Rapid diagnostic tools and culture tests can help determine whether an infection is bacterial, and which antibiotic, if any, is appropriate. One of the ongoing challenges we face in the pharmacy is patient pressure. Many individuals arrive with the expectation of receiving antibiotics, often viewing them as a quick fix for common ailments like colds or sore throats. When they leave without a prescription, some feel disappointed or even frustrated. This reaction, though understandable, highlights a gap in public awareness about when antibiotics are truly necessary. This is where effective communication becomes not just helpful but essential. We need to dedicate time and empathy to explaining why antibiotics aren't always the right solution. It's crucial that patients understand the risks of inappropriate use, how it can lead to antibiotic resistance, reduce treatment effectiveness, and pose long-term dangers for both individuals and society at large. When people recognize that not every illness requires an antibiotic, they're more likely to support responsible use. Preventive strategies are essential in combating antibiotic resistance. Vaccination, hand hygiene, and infection control measures reduce the need for antibiotics in the first place. In the pharmacy setting, we can promote antimicrobial stewardship by reviewing prescriptions, flagging inappropriate use, and educating both patients and prescribers. We also encourage patients not to self-medicate or share antibiotics with others, practices that are unfortunately still common in many communities. In terms of innovation, researchers are working on new classes of antibiotics, but development is slow and costly. That's why preserving the effectiveness of existing antibiotics is so critical. Phage therapy, using viruses that infect and kill bacteria, is being explored as an alternative in resistant infections. Other promising approaches include antimicrobial peptides, microbiome-based therapies, and CRISPR-based gene editing to disable resistance genes. But these are still in early stages, and for now, our best defense is responsible antibiotic use. Looking ahead, pharmacists must continue to lead in public education, policy advocacy, and clinical practice. We are often the most accessible healthcare professionals, and that gives us a powerful platform to influence behavior. By promoting responsible antibiotic use today, we can help ensure that these life-saving drugs remain effective for future generations.